My name is Brittany, and I'm going to be your nurse today. Today, I'm going to be completing a complete health history, and I'm going to be asking a few questions, and it'll be about 10 to 15 minutes. Now, please know that everything I say between us will remain confidential, and I will be jotting down a few notes along the way. First, I'd like to ask you a few questions just for your biographics. Can you please state your full name?
Sharon Marie Dotson.
Okay, and your date of birth?
8/20/68.
Okay, and your marital status?
Married.
And your occupational status?
Office manager on sales.
Okay. Now, can you tell me what brings you in here today?
Having pain in both of my feet.
Okay.
Worse than the left.
Okay. Now, what do you think brings on the pain? What seems to bring it on?
I guess walking. I guess the heel, the pain is worse in the heel, so walking would.
Okay. Okay. What were you doing when you first noticed the pain?
I guess again I was walking, and
okay.
Just gradually got worse.
Okay. What seems to make the pain feel better or feel worse?
Resting the foot makes it feel better. Typically, the more I walk, and depending on what shoes, that can make it worse.
Okay. If you had to describe the pain between sharp, throbbing, or aching, which would you say?
It depends. At times, it's more like a sharp, and then other times, it just, it's just like, I would say, like a dull ache.
Okay. And between mild, moderate, and severe, how would you describe it?
Again, that kind of varies. At times, it's severe, but then other times, it's not quite as bad.
Are you currently having pain right now?
Some, yes.
Okay. And is that less severe or more severe than it usually is?
Right now, I would say less.
Okay. Does the pain seem to affect any normal daily activities that you do?
No, not typically because of my job. I typically sit all day, so I'm not up on my feet.
Okay.
But then in the evenings when I am, it seems to bother me more.
Okay. Can you show me exactly where your pain is located?
Most of it that I'm feeling actually right now is on the heel and the side of my foot.
Okay. And does that pain seem to radiate or spread elsewhere, like maybe up your leg or into more of your foot?
Typically no. It's kind of in that general area.
Okay. And if you had to rate the pain on a scale of 0 to 10, with 0 being no pain and 10 being the most pain you've ever experienced, what would you say?
I would say probably I would say maybe like a 5.
Okay, and would that be the same for both feet?
The other one right now, I would say like 0.
Okay.
At this point.
And would you say that the pain is getting better, worse, or staying about the same?
I would say, again, it kind of depends on what I do as to how it feels. So, it's in the left foot. It's been a little worse recently than it had been.
Okay. Do you have any idea maybe what's making it worse?
Not really, no.
Okay.
I mean, I've not had any changes.
Okay. And about when would you say that the pain began?
I've probably had it for 6 or 8 months.
Okay. And did the onset seem to be more sudden or gradual?
Gradual.
And for both feet it was?
Yes.
Okay. And about how often does the pain occur? Is it pretty much on a 24/7 basis?
Yes, pretty much, it's a regular basis.
Okay. And do you have any idea maybe what caused the pain? Maybe standing on your feet too much or what?
I would say, again, it's noticed more when I'm up on my feet or if I'm on a concrete floor for any length of time, it seems to worsen.
Okay. And how does the pain affect your everyday activities? Does it make you maybe not stand as much? You feel that the pain bothers you in that sense?
Not really, because again, my job doesn't require standing all day, and so I would say, like, more in the evenings, I try to make it a point to rest it.
Okay.
And
what are some things that you've tried that have seemed to help?
Putting it in hot water with Epsom salt seems to help. At times, like a Bengay or something like that will help ease it, and of course, just resting it.
Okay. Now, I'd like to get some information regarding maybe some past or more present medical history, not regarding your pain. First, can you tell me about your past health history regarding any hospitalizations or any surgeries that you've had?
Let's see. In March of '89, I'd been hospitalized actually in September of '88 for some pain in the right side. And in March of '89, I had surgery for, it was a laparoscopic surgery to determine where the pain may be coming from because
Okay.
it hadn't gone away. And that it was determined at that point that I had endometriosis. And then that summer, July of '89, I believe it was either July of '89 or July of '90 that I had got pregnant and miscarried
Okay.
within the first 6 weeks. Then I got pregnant again, and shortly after, and we lost the baby then in December of 1990. After I had the miscarriage, I had a DNC,
Okay.
and then let's see, got pregnant with our son in February the following year. I had a cerclage in June, which would have been '91, and hospitalized at that point. Then he was born in November, and then a couple years later, then same thing. I had a cerclage when we found out I was pregnant, and then our daughter was born in July. And then I was hospitalized, I want to say it was early spring. I'd have to really look at some records, but several years later for what came out to be acid reflux, and also it was determined that I have irritable bowel syndrome.
Okay. And were there any surgeries along the way, or any surgeries that
Actually, I did. I had arthroscopic surgery on my knee in February of '88. And that was torn cartilage in the left knee from a car accident.
Okay.
And other than, I guess, the cerclages and in the hospital for the acid reflux and the irritable bowel, that's pretty much.
Okay. Do you have any significant family history, maybe regarding heart disease, obesity, diabetes, or cancer?
Heart disease. My grandfather, my mother's father, passed away from a heart attack. That's about that. And my grandmother, actually, she has a pacemaker. So that would be the heart disease. As far as like a lot of obesity or cancer, no, not that I can.
Okay, and any diabetes?
My father, but it's not from youth or he was born with it. It's more because of weight and
Okay.
diet.
Okay. And are you allergic to anything in the environment, any medications or foods?
Sulfa, pretty much the only medication that I'm allergic to.
Okay, and what sort of reaction do you have if you come in contact with it?
Hives.
Okay, and what sort of treatment would you seek?
Benadryl.
Okay. And are you taking any over-the-counter medications or prescriptions right now?
I do take Bentyl for the irritable bowel syndrome. Take that every day. Take a birth control pill, and I also take a fish oil capsule.
Okay.
Every day.
And how long have you been on the Bentyl and your birth control?
The birth control I've been on since I was 19,
Okay.
and the irritable bowel I would say probably 7 years.
Okay. And do you know about how many milligrams your irritable bowel medication is?
I want to say maybe 10.
Okay. And can you tell me what your diet consists of a normal 24-hour period?
It varies, but usually coffee in the morning, sometimes oatmeal or like a bagel. For lunch, typically it kind of varies, but usually like a small soup or frozen meal with a fruit and a yogurt. And then dinner normally, just your typical meat, I guess pasta and vegetable.
Okay. And do you engage in any physical activity on a regular basis? And if so, how often?
Unfortunately, no.
Okay. Just no time for it?
Pretty much no time.
Okay.
Just a lot of work.
Yeah, I understand. Do you currently use any tobacco products?
No.
And have you ever?
No.
And have you ever or currently used any recreational drugs?
No.
Okay. And do you currently consume any alcoholic beverages?
No.
Okay, and have you ever?
Occasional.
Okay. And as far as occasional, would you say maybe here or there with a meal, or just kind of like at a party or
I would say
something?
social.
Okay,
More
more
social.
social?
Mhm.
Okay. Well, now I have all the information that I need. Is there anything else that you feel I should know that I haven't already asked?
Not that I can think of.
Okay. Well, now I'm going to give all this information to your doctor. He's going to review it, and he should be in shortly for the physical exam. It was nice speaking with you.
Thank you.